VOA Special English Development Report. Each year, millions of babies are born too soon and too small. Premature or preterm births are defined as births that take place earlier than 37 weeks of pregnancy. Prematurity is the leading cause of death in newborn babies. More than 1/4 of the 4 million newborns who die each year around the world were born too early.
Premature delivery is a leading cause of death for newborns, and the rate of babies arriving too soon has climbed a staggering 36% since 1984. Technology and medicine have improved by leaps and bounds since then, so why is the preemie rate rising?
Assalamualaikum and good morning everyone. It's your newsreader, Balqis Humaira. I'm here to sprinkle some news into your day. Hold on to your hats because we are diving into World Wide of Baby Buzz. Brace yourself, mamas-to-be, because today we are going to debunk a little myth that's been floating around. Some folks are pointing fingers at a mysterious new virus that is said to attack only pregnant women. The virus is called the virus, and it is said to cause the pregnant woman to suffer from preterm birth and other birth complications. But some will ask, what exactly are preterm birth?
Preterm birth is a birth that takes place more than 3 weeks before a baby is estimated to be born. A normal pregnancy lasts for 40 weeks. A birth is considered premature when it occurs before the 37th week of pregnancy. Babies born prematurely are known as preemies.
But don't worry because we've got our doctor's coat on and the truth is about to be unveiled. So grab your coffee, cozy up, and let's sift through the headlines together. Now, let's dive into the heart of matter with our guest today, a fellow mama-to-be, Mrs. Nisa. Now, Mrs. Nisa, tell us, what keeping you up at night? Which worry these days?
Hi, I am Nisa. I am 24 weeks pregnant. Is it true that virus is attacking us, the pregnant woman?
Can you explain more about this virus? What is their attention?
I'm not very sure, but I heard that this virus can make the woman suffer from preterm birth. I'm so scared.
I see. It's okay, Miss Nisa. Please calm yourself down because after this, we are going to have an interview with a doctor. Alright, thanks Miss Nisa for your time. Guess what? Doctors and researchers worldwide are trying their best in order to find a solution for this virus in order to keep the pregnant woman safe. Okay, so for more explanation, I will pass this news to my friend. Hi, I am NAZURAH. I'm from Hospital UNISA. Here with me, Dr. ZULAIKHA. Hi, Doctor. How are you? Hi, I'm fine. Thank you. Can you give us a bit explanation on what is happening right now among pregnant women? I heard there is a virus called virus. Is it true that the virus choose only pregnant women as their target?
Huh? Virus? I've never heard about the virus before. It's way too far from me.
It is said that to cause the pregnant woman to have preterm birth and complications during their birth. Is it true?
Okay, first of all the things that are happening right now is not because of the virus.
Then, if not a virus, what is it?
So calm down. One of the causes is because today's pregnant woman doesn't follow the dietary recommendation given by the nutritionist.
Can you explain a bit more on the topic?
Okay, firstly, they consume excessive amount of alcohol. Heavy alcohol drinking during pregnancy is associated with small for gestational age, low birth weight, preterm birth, and fetal death. Smoking during pregnancy also can cause the same problem.
I see. So the problem is because they choose to be selfish and ignore the nutritionist advice. So doctor, does preterm birth and birth complication only happen due to smoking and intake of alcohol? Of course no.
The 3 risk factors that make you most likely to go into premature labor are: you have had a premature baby in the past, you are pregnant with twins, triplets or more, and the last one is you have or had a problem in the past with your uterus, cervix or vagina.
So can you give us a recommendation or ways to prevent from this problem to happen?
Sure. Pregnant women need to consume adequate amount of micronutrients. For example, is iron. Iron supplementation are given to the pregnant woman of 100 mg during second half of pregnancy.
What happens if the pregnant woman doesn't consume enough iron?
Iron deficiency might happen and also increase the risk of maternal infections, which can stimulate the production of CRH and are a major risk factor for preterm. Pregnant women will experience depleted iron stores with weakness, fatigue, short attention span, poor appetite, and it will increase susceptibility to infection and irritability.
Are there any micronutrient that it could be consumed during pregnancy?
And yes, there is selenium.
Selenium plays a significant role in the undisturbed functioning of the reproductive system. Many studies have addressed correlation between its intake and fertility as well as disorders of procreation processes. Selenium deficiencies may lead to gestational complications, miscarriage, and the damaging of the nervous and immune systems of the fetus.
I see. So iron and selenium does play a big role to prevent birth complications. So I think that's all the interview with Dr. Siti. I will continue the next interview with Dr. Humaira via video call.
Hi Dr. Humaira, how are you today?
Hi, I'm fine. I am very excited for this interview.
Thank you for willingly do an interview session with me. So before we start, have you heard about the Prague virus?
Yes, I do hear about it, but I believe that's all only a metaphor. Because preterm birth and birth complications are not something that can be spread through the air and such.
Yes, I agree about it. So for today's topic, can you explain about the intake of micronutrients called magnesium and folate related to this problem?
Magnesium is an essential mineral required to regulate body temperature, nucleic acid and protein synthesis with an important role in maintaining nerve and muscle cell electrical potentials. It may reduce fetal growth restriction and preeclampsia as well as increase birth weight.
What if the pregnant woman doesn't consume adequate amount of magnesium?
Magnesium deficiency could be associated with increased health risk for the maternal-fetal binomial, including IUGR, gestational diabetes, preterm delivery, and preeclampsia.
What about folate?
I believe that folate is known by all pregnant women because it's very important in pregnancy in order to prevent NTDs.
NTDs, what is it?
NTDs stand for neural tube defect. NTDs occur when the neural tube does not close properly. The neural tube forms the early brain and spine. This type of birth defect develops very early during pregnancy, often before a woman knows she is pregnant. The two most common NTDs are spina bifida, which is a spinal cord defect, and anencephaly, which is a brain defect.
I have read somewhere that a required amount of folate intake is 600 micrograms each day. Is it true?
Yes, you are absolutely right.
Okay, thank you Dr. Humaira. I think that's the end of our interview. I will pass this news to the newsreader.
Hi, and back with me here again. So I think the mystery is solved. It's not a virus but a negligence. Pregnant women should make this as a lesson and has to follow the requirements of micronutrients such as magnesium, iron, folate and selenium. Pregnant women are also recommended to limit alcohol and caffeine consumption in order to prevent birth complications, said just now by Dr. Siti, because preterm birth and birth complications is not something you can ignore. So I think that's all the news for today. Thank you and may every pregnant woman are happy and healthy.